we'll go ahead and start with our last presentation of the evening.
Hi, everyone. Can you hear me okay? Oops, sorry.
Yes, we can.
And we see your slides.
Hi, I'm delighted to be here, and even more delighted that you've agreed to stay here at this very last presentation.
Jim, you need to share the slide.
Okay, well, we see the slides up there. We see your team slide. So I think that's what you wanted.
Yes, that's the one slide.
Okay, so that's up there. All right, gentlemen, I'm going to go on mute and turn off my screen. So if you're ready to go, I'll hit start. Okay.
Okay. Do I need to hit any screen sharing, or am I there?
We are good, Jim. I think you can go ahead, please.
Well, like I say, I'm delighted. I'm delighted to be here, and delighted that you stayed to hear this presentation for SyncLine Health. I'm in the middle here. My name is Jim Henning. I'm an MD. I'm board certified in 2 specialties, internal medicine and anesthesia. Most of my training was at Stanford and UCSF in a sort of a back-to-back residencies as a Robert Wood Johnson clinical scholar. I did research in medical education, diagnostics, and also economic policy at that time. And in the intervening years between then and now, I've been an anesthesiologist in the Bay Area in Palo Alto, adjacent to Stanford. And in 2010, I kind of got interested in the communication platform between doctors and patients. I enjoyed that very much, and the service delivery platform in healthcare was just starting to evolve, and I was interested in how to inspire doctors to become more forward-facing in the new digital health economy. And so I did go to work at a startup with Gabe, who's on my left there in the picture, to try to understand physician ethnography, how to inspire doctors to come and participate in a more giving sort of economy. It turned out it was no easy feat to inspire doctors to give of their time without compensation, and I was puzzled by the fact that I was really interested in doing that, and I knew other people who were as well. But there were many, many people who, for one reason or another, were not so inclined. And so we did some human-centered research. We did qualitative research so that I figured out ways to metricize so that we could actually quantify specifically who fell into what persona category. And basically their psychography was something that was just, it became such an intimate thing to me to understand my colleagues at that level, to understand demand drivers and what inspired them, their inspired drivers. And so after that experience at the startup, which was mostly positive, but not totally, I wanted to go to business school to try to understand how to become a better leader in that context, because I really enjoyed it. So I did end up going to Dartmouth and attending business school there on the delivery system science side, understanding what constituted best practices and what was coming down the pike. And so I did that. And Moses, my other presenter, who is a bioengineer, and I had been working on a project to ideate physician display of monitoring that might come in after repetitive feeds, that was user-friendly and that people could look at for long periods of time without getting stressed or tired. And so together, we did ideate a solution set that he helped come up with. He founded a company and invited me to participate with him as the CMO and the co-founder. So SyncLine Health is basically, we're an early stage startup, I should say. We synchronize remote care into a single care experience. In other words, we're trying to integrate all parts of the remote care platform, synchronous and trending agnostic device monitoring, provider dashboard display, audio capture, NLP enhanced analysis, and documentation of standardized progress note formatting, telepresence, so texting, and video feed immediately from inside the app. No need externally to go onto another telehealth platform, although I realize people are doing that anyway, and instant entry into the revenue cycle management stream. So I wanted to underscore that this is the slide, our value system. I think this is really important in the startup age. We have values that drive our strategy, and we have strategy that is driving our build out of our solution sets. So we value simplicity and integration. We're a process innovation company. We're not a content innovation company. There are plenty of those, but we exist to simplify and reduce the complexity of what's becoming the primary healthcare platform. We're also relationship-centric. Patients are at the core of this whole experience. I mean, they are the reason we are here, as Paul Deschamps says so eloquently. Recognizing that relationship is at the core of meaning for doctors, and absent that, people commit suicide because of that absence in their lives. Also, we also feel strongly that we are custodians of patient assets. All of this historical information, biometric, personal preference information, their narratives, all of that, we feel like we're custodians of that, almost like a financial institution. It's their data at their discretion to choose. If we can make it easier for them to get around the obvious problems of interoperability and lack of revenue in different domains, then we're all about that. So also,
are you sharing slides? I can see only one slide.
did you see me?
Yes, now it's going on Jim
Okay.
process.
So I'm still on this prior slide. We also believe strongly in platform ubiquity. Again, a term from the financial world, but I think it applies here. We value collaboration and partnership. We want to inspire people to jump on with us and to contribute to what we've done. Here's a snapshot and review of what I've said. This is essentially what we are doing is rejiggering the wiring and connections between gadgets. So gadgets are point solutions that ironically complicate the workflow, as beautiful as they are. And here, and I do think these are beautiful displays that Moses has created. These are what the patient sees. These others are monitors of what the doctor sees. And they typically, what we're going for here is uncluttering the experience. And I think we've done that pretty nicely. There's no solutions to problems, existing problems. I mean, we've exhausted ourselves listening to them in the last couple of days, but a couple of things worth noting. Everything is siloed. Communications are siloed. Care systems are preferentially designed to expand and not contract. That's not the way it's going to go in the future. And this fundamental instability is what we've chosen to address in our solution sets. So widgets add problems to workflows. Disjointedness happens. Communication barriers, the burnout, all of that happens. So our solution sets I call the 3 Ds: devices, displays, and documentation. These are all proprietary and under review for intellectual property right now. Excuse me. We are device agnostic company enabling remote monitoring with any FDA-approved and connectivity-enabled device. They show in one single user phone. There's no need to interface separate apps for that phone. It all displays through the SyncLine app. We have a singular view dashboard that's a proprietary display that synchronizes and trends continuously, if we want, consolidates and displays all critical data across multiple devices. And finally, our platform is API enabled to potentially integrate and be interoperable with any EHR system. This is a more dense slide about our product specifics, but I'll just talk you through the main points here. In terms of SyncLine monitors, we can deliver prepackaged for COVID-19, for example, acute care scenarios, for surveillance. We can be integrated easily into any CCM pathway. Up to 40%, maybe even 50% of all hospitals are now incentivized to include remote care monitoring into their CCM pathways to be ready for the future of healthcare. SyncLine Telescribe has a very personal meaning for me and for all of us because of the fact that documentation is such a poisonous to doctors. And we'd rather see people watching one another than their screens. So we're trying to AI enable a system that structures, organizes, and standardized all clinical information in documentation to reduce burnout. That means, like my mentor and one of my attendings at Case said, the medical record is the practice of medicine. It's not organized now. Still at Stanford University, I can look at medical records that are done in the most sophisticated center in the country, one of them, and everything's done listed chronologically. That's insane. that's of no use to anyone. And so we're going to fix that. We're in the process of fixing it. And SyncLine Biz is a cycle analytics that addresses the proximate and the remote causes of poor revenue cycle management. In the short term, reducing direct cost is really important because we're still under a fee-for-service system and we need to, capture revenue, and that's important. But in the long term, we feel like receivers downfield waiting for the ball to snap. I mean, the value-based future is coming, and so we'll need to be providing ways of reducing healthcare utilization. The last slide that I have here is basically a schematic of what I've just said. From platform representing integrated workflows, from the agnostic device capture through proprietary patient app and display, cloud storage and analysis, provider dashboard display, audio capture, NLP enhanced progress note formatting, which is becoming smarter and smarter every day, immediate connectivity to patients via SMS or telepresence, EHR push or pull, integration into revenue cycle export, which brings us to finally our product maturity.
Hey, James, we're actually out of time. Sorry, I thought the last slide was your last slide. We went over. If there are no questions, we can go back to this, but let's give everybody a chance to ask some questions. Judges, do you have any questions for James or Moses?
Moses.
I'm curious about the business model. Like who do you see the buyer is and what the value creation is for them?
Well, I would like to invite Moses to field these questions, if he would. Moses, can you hear me?
Absolutely. Yeah, that's a great question. And also we identify our target customers, providers, primarily healthcare systems, as well as, CMS-based Medicare and the grants. And the payers, the insurance companies are our partners as well. We are targeting them because of there's an opportunity there. Our SyncLine solution can reduce the errors in the reimbursement claims and everything, so it's more efficient in both ways. And EHR partners, I think we have capability to integrate in many EHR systems, and there is a synergy in our business to partnership with them because we both share the common customer segments we serve. So these are primary customer segments.
Okay, do we have any other questions? About from the audience? Okay, well then why don't you guys go ahead and try and finish up your presentations since I cut you off.
Jim, you want to go to the previous slide? Maybe next slide we give. Can you go to the next slide, Jim, please?
We just have 3 minutes though.
Yeah.
Yes. So we quickly go about our product maturity. So we have a 3 product, like Jim said. Those 3 products are, like I said, SyncLine monitors and Telescribe and SyncBiz. SyncLine monitor is currently being piloted at the health center in COVID with the COVID patients. So far, results are good and encouraging, and we continually going to scale up. For the SyncLine Telescribe, it's basically, the doctor-patient's conversation during the televisits. Nowadays, everything's almost like a televisit for the primary care level, but not much real documentation done. What we did was that during the conversation, we were able to collect all this information and organize it in a way that it can easily upload into EHR, mapping to their, the fields and making sure that they are easily consumable. And more than that, the data, the accuracy of it's very high, means that the manual scriber, we were not sure how much is accuracy. We can confidently say so we have a 90% accuracy of transcribing from voice to text to categorization and annotation into your meaningful medical documentation. We can say about 85% confident. The SyncLine Biz also Jim talked about, but a little bit of that we are still working on it, and we are not ready for a pilot yet. But for a SyncLine Telescribe, we are ready for a piloting. We're looking for if anyone would like to test our product. We're happy to do a pilot in your site. This slide is we are looking basically for 300K for our scaling up. The challenge is currently we have a product which has been in the medical centers. So we have a small group of initial pilot going on, but we need to scale up. And they're also interested in potentially using our solution for chronic conditions, diabetic, hypertension, and others. So we are on the verge of scaling up a pilot. So what we need is that looking for 300K for scaling of piloting, and hopefully that will help us to move to complete the pilot and complete our clinical study and come up with a clear white paper about what has been observed, what has been outcomes, and all the things. So we are truly looking forward to anyone if interested. Please let us talk to us. Jim, next.
How are you integrating with the electronic healthcare records?
Yes, that's a great question. We need two hands to clap, which means that we are ready to clap. Means we build a lot of microservices, HL7 and FHIR framework, FHIR FHIR framework, and we also gone beyond that. We have templatized in a way that if any of the EHR system they wanted to receive our data through FHIR, we ready to go. Otherwise, they want to push the data, we are ready to go. Again, this is not the end of the day. It is a technological communication and mapping and matching the data to pull and push the data. So I hope many EHR systems have to do that, because some of the EHR system not ready with the interoperability, with whom it's very difficult to integrate, obviously. But many of them are moving in the direction like Epic. Obviously, they are there, Cerner there, Athena there. So we have ability to integrate our data into the EHR system.
Okay, well, thank you very much, James and Moses. That was a great presentation. Uli, could you put up the poll, please, for them? So I have to ask, because I'm a nerd, is that a virtual background? Because it looks exactly like the Olive Health background with different writing.
Yeah, like Olive Health is copied from us. Just kidding. No, yeah.
They copied you guys, right?
I didn't think you wanted to.
Did you guys just pick up the signs off the wall and put your sign on the wall?
No, yeah, we just bought them. No, actually, there is you can have a logo. Yeah, if you have a logo, you can simulate it and put it on the back. When I saw Olive, we were kind of, I also a little bit surprised that both of them think alike. Put the slide on it. So
well, great minds, I guess. That's awesome.
And you can just see the halo around the head when you move.
Yeah, my name is Moses, by the way. Just kidding.
That's right. That's right.
Yes, thank you so much.
Right.
Again, we have to thank you for all of you. Dr. Chettipalli and Ruchi Su, to Oren, to everybody. We can thankful enough for such a great organization of this, for an opportunity given to us to present this. Much appreciated.
Yes. Well, it's our pleasure. And speaking for Uli, of course, because I've got the mic. But we'd also encourage you to go to the Global Health Impact Network, post your companies there. Everybody, please. Any other companies wants to post there. It's great. People can talk about them. We've got lots of doctors there who want to interact and learn more about your companies and be involved with innovation. Guys, there are a couple more questions in the chat, so go ahead and answer them after you get a chance. So we're done.